Dear students, now let's go to the inside of the heart. This is the heart that is removed from within the mediastinum. Here is the diaphragmatic surface. This is the superior end, the inferior end, the right side and the left side. So the surface that you see here, this is the anterior surface of the heart. This is the diaphragmatic surface of the heart. So this is the part of the heart that sits on the central tendon of the diaphragm. Okay, so this is the right surface of the heart. This is the left surface of the border. This is the inferior border. Okay, here is the right border, the left border. Here is the superior border. The superior border is obscured by the pulmonary trunk, the ascending aorta, the superior vena cava. So these vessels are actually obscuring the superior border. So in fact these are the borders. My right hand, superior border, inferior border, this is the inferior border, the right border, left. So this is the sternocostal surface, which is related to the sternum and the ribs. Diaphragmatic surface, or the inferior surface, that sits on the central tendon, is the right surface. And when I turn this, now you see this is the posterior surface of the heart, or the base of the heart. The base of the heart that is constituted only by the atria. So see, the base is opposite the apex. Here is the apex of the heart, and exact opposite the apex here is the base, because it is a conical organ. The heart is a conical organ, isn't it? Right. So here, this structure here, this is the interventricular septum. Okay, so here you have the right ventricle. Here you have a part of the left ventricle. Here is the right atrium. Okay, and the left atrium is completely on the posterior surface. This is the left atrium. Now how do you identify the atria? Because we will be opening up the atrium, the right atrium first, and then going inside the right atrium, and later we will open up the left ventricle and the left atrium and the right ventricle. So all the chambers, we will go inside all the chambers and see what is inside. So how you identify the right atrium? So this is the right atrium. Here is the superior vena cava. So inferiorly there is the inferior vena cava. This is where you have the opening of the inferior vena cava. So all this is blood clot. Okay, just chill inside that, because it is just taken out from the mediastinum. So anyway, so all this is going to be there. So all that is blood clot. So the chamber to which superior vena cava and the inferior vena cava open is the right atrium. So this is the right atrium. Okay, and this is the pulmonary trunk. The chamber from which the pulmonary trunk arises is the right ventricle. So this is the right ventricle. Okay, and the chamber from which the ascending aorta commences is the left ventricle. You see, follow this ascending aorta somewhat obliquely. So this is where you have the left ventricle. Okay, see the ascending aorta that arises from behind the pulmonary trunk, so passes behind it. So this is where you have the left ventricle. This is the right ventricle. This is the right atrium. Okay, the only part of the left atrium we see is the left auricle. This is the right auricle, the left auricle. So now I'm turning this to see the base or the posterior surface. So here is the posterior surface with the atrium. The left atrium can be seen here. So this is the left atrium. The left atrium has the openings of the pulmonary veins, 4 pulmonary veins. Okay, 2 right pulmonary veins and 2 left pulmonary veins. So this chamber here is the left atrium. Okay, right. So these are the chambers of the heart and the borders and the surfaces. Now let's see the diaphragmatic surface or the inferior surface. This is the inferior surface. Here you see the interventricular septum, that's the posterior interventricular septum, separating the right ventricle. See this right ventricle from the left ventricle. This is the left ventricle. So the left ventricle and the right ventricles on the diaphragmatic surface are separated by the posterior interventricular septum, and on the sternocostal surface the right ventricle is separated from the left ventricle by the anterior interventricular septum. In both the septa you will find the vessels. Here is the anterior interventricular artery, here is the posterior interventricular artery. So now that we have identified the chambers, so let us open up these chambers in order to see what is inside. So first chamber I am going to open up is the right atrium. See, this is the right atrium. You see the opening of superior vena cava, inferior vena cava. Now see, extending from the opening of superior vena cava to the inferior vena cava on the outside, we have a very faint groove here. This one, this groove is called Sulcus Terminalis. So I'm going to divide, sorry for that noise, I'm going to divide the right atrium, or open up the right atrium along this line. Okay, so I'm making an incision here along the sulcus terminalis. This is the sulcus terminalis. So you know it is the sulcus terminalis which actually separates the interior of the right atrium into, well, the parts, a smooth posterior part and a rough anterior part. So now just opened up the right atrium. See, all this here is blood. It's completely blood clot. Such a huge bundle, right? So there is more. I'm removing all this. So only when we remove all this blood clot, we'll be able to see the features on the inside of the right atrium. So all this is completely blood clot. Okay, so now we see the features here on the inside. So you need to wash, give it a wash. Since washing it is not possible here while I take the video, so I may have to switch to other specimen. So already dissected. Anyway, we can see some features here. So now I have divided the right atrium along this sulcus terminalis. So sulcus terminalis divides the interior of the right atrium into a smooth posterior part and a rough anterior part. You see, this is the rough anterior part. It consists of lots and lots of muscles. It's called musculi pectinati. Right. So this is the smooth posterior part and this is the rough anterior part. So in anatomical position you can see this rough anterior part. So just open it up. This is the rough anterior part. Here is the smooth posterior part. So we see the opening of the superior vena cava. Here is the opening of the superior vena cava into the right atrium, and here we see the opening of the inferior vena cava, that is opening into the right atrium. So the opening of the inferior vena cava is bigger, the lumen is bigger. So what we see here, we see the opening of superior vena cava, we see the opening of inferior vena cava. So the opening of the inferior vena cava is guarded by a valve, isn't it? So the valve that is formed by the reduplication of the endocardium. So what do you call the valve of the inferior vena cava? The valve of the inferior vena cava is called Eustachian valve. So the Eustachian valve will be guarding this opening of the inferior vena cava. So in embryological life it will have significance, okay, not now. So superior inferior vena cava openings, and then we have so many tiny little openings of the vena cordis minimi. Okay, so it will open up all over the chamber, so you can see all inside